Let's see this picture. Then we go discussing this point if you want. Okay, yes. That is better probably. Okay, this is the 1 millimeter membrane. Let's see the defect. Okay, it's vertical, of course. Vertical and horizontal always. Vertical is always horizontal itself, of course. I have to remove this tooth, but I can leave it right now because I'm using resorbable membrane. It's not a problem if I leave the tooth. I will remove it after that if I want. And it's supporting the temporary bridge. Let's see frontal view. Okay. I will show you the technique, how to do that. But this is a 1 millimeter pericardium. Let's see. Really well stretched, really well fixed. It seems to be an APTFE membrane, but it's close to the teeth, is in contact with the teeth, and is well stable here at the mandible, at the lingual site, okay? Let's see the membrane. This is the bottom. This is the bleeding. This is the implant there. This is 4.5. The other is 3.8 millimeters. This is a superimposition of the CBCT scan.
1 millimeter thickness.
1 millimeter thickness. Let's see. Let's see the bone augmentation. This is a video of the bone augmentation. We did. Without space management. Yeah. Let's see the augmentation is 4.6. Vertical. You see that? Okay.
Is it related to the distance of the defect, the width of the defect?
It depends on the distance of the defect, of course, and it depends on the membrane. But it is a defect from here to there.
It's not big defect. Like
it's not so big, of course. If you ever so big, I will change it. But what I say, just to resume, if you have horizontal defect, go for resorbable membranes. The best one, in my opinion, is the pericardium membrane. If you have a little vertical, up to 4, 5 millimeters, maximum 5, if the bony peak are not so far, go straight with the pericardium membrane, 1 millimeters or 0.8 slow, that means slow resorbable. And you don't need to have something to maintain the space.
It depends on the backing of the bone and the elasticity of the pericardium membrane.
It depends on the elasticity of the pericardium membrane and how you tack it on the native bone, how you fix it and you stretch it. And you can avoid completely the use of PTFE membrane for this kind of reconstruction. I will show you cases right now about that. But let's see the quality of the bone. And we went vertical, you see, of course. Then, if you're using just collagen membranes, you can go horizontal, not vertical. If you are moving to the pericardium, probably you can reach more horizontal and some vertical, without any other devices, just the tacks to stabilize the membrane.